Welcome to the 30-day PTCB 2026 Study Bootcamp, brought to you by PTCB STUDY. This video offers an accelerated study plan for 2026 Pharmacy Technician Certification, covering all competency areas, a detailed schedule, and essential study resources. The PTCE 2026 exam includes weighted domains, medications, 35%, safety and QA, 23.75%, order entry, 22.25%, and federal law, 18.75%. The exam format is 90 questions in 110 minutes, with a passing score of 1,400. Your daily study routine involves 25 minutes of drug flashcards, 45 minutes of content deep dive, a 30-minute timed quiz, and 20 minutes for error review. We will rotate subjects based on exam weights and use spaced repetition on Sundays. Essential resources include the official PTCB outline, bite-sized presentation videos that are less than 5 minutes each. Listen to the video. You may pause on each slide to read the slides. Use the flashcards to understand the concepts, then take the quiz for the particular section completed. This will create a better memory of the subject matter. It will increase your recall. Don't panic if your review quiz scores are low. Week after week, you will take the same quizzes again and be able to improve your scores. Remember to track your mistakes and scores in a dedicated notebook. Days 1 to 4 focus on foundations and pharmacology. Target 5 to 10 new drugs daily, focusing on the top 200 commonly dispensed. Learn drug classes using suffix patterns and use flashcards for comprehensive recall of generic name, brand name, class, and indications. Days 5 to 6 focus on pharmacology by system. Study drug classes and conditions for systems like cardiovascular and endocrine. Review black box warnings, pregnancy categories, and the difference between A-rated, interchangeable, and B-rated, not equivalent drugs. On days 7 to 8, focus specifically on life-threatening drug interactions. Study specific risks like QT prolongation and serotonin syndrome, and common culprits like grapefruit, warfarin, and MAOI lines. This is critical for the PTCB. Day 9 focuses on storage, stability, beyond use dates, and the DSCSA. Understand the differences between refrigerated and room temp storage. Review light protection, bud calculation, and DSCSA serialization for product tracking and integrity. This slide includes high-yield tips, traps, and questions. Focus on core competencies and detailed rationales. Be aware of LASA drugs and use elimination logic. Review these daily for 1 hour. Days 10 to 11 focus on controlled substances, laws, and record keeping. Use mnemonics for drug schedules. Know the transfer rules for different schedules. Remember that record keeping requires maintaining records for a minimum of 2 years. Day 12 covers inventory management, including receiving, daily counting, and secure storage. Critical focus areas are immediately, quote, reporting significant theft using DEA Form 106 and following proper quarantine procedures for damaged or recalled items. Just a recap, C2 order form is 222 DEA form. 4.1 is request permission from the DEA to destroy controlled substance. Form 104 to voluntarily surrender of controlled substance privileges. Day 13 focuses on the supply chain and product integrity. You must know how to verify and trace products, quarantine suspect items, and use unique serialization identifiers. Always verify the credentials of wholesalers and distributors. Day 14 reviews drug recalls and REMS programs. Understand the 3 classes of recalls. Study REMS drugs like isotretinoin and clozapine, including their strict monitoring requirements. Know the pharmacy responsibilities for managing recalls. Practice scenario-based questions for controlled substance prescriptions, focusing on verifying and refusing altered scripts. Also, be prepared for DSCSA alerts, where the immediate step is to isolate, report, and investigate discrepancies. Day 15 covers high-alert medications like insulin, anticoagulants, and chemotherapy. Key safety concepts include using tall-man lettering, segregating high-alert drugs on shelves, and implementing double verify rules for critical steps. Day 16 focuses on error prevention. Mitigate look-alike, sound-alike LASA risks using tall-man lettering in separate storage. Use barcode workflow for verification. Ensure an independent second check, and no patient counseling triggers. Day 17 differentiates between a near miss and an error. Practice root cause analysis to identify systemic causes of errors. Understand the purpose of the MedWatch form and the benefits of a blame-free environment for safety culture. Day 18 focuses on sterile compounding safety protocols. Review the hand hygiene moments, ISO standards for clean rooms, the proper garbing order, and the steps for spill cleanup protocol. Practice your garbing order physically. Review medication error cases, such as wrong route and wrong dose errors. Understand the NCCM ERP categories, CD, the crucial role of the pharmacist, and the importance of a reporting culture for system improvement. Please pause and review this slide. You may have to zoom the page. Detailed pearls are all cramped in one page in this slide. Day 19 covers medication safety and clarity mandates. Master the top 100 abbreviations and avoid those on the do not use list. Employ tallman lettering and follow clarity mandates for legible and unambiguous instructions. Day 20. Review insurance-related components. Day supply limit. Some insurances will limit a 30-day supply. Some insurances will need a 90-day supply for maintenance medications. Beginning of the year, you will see higher copays as people have to meet their deductibles. Medicare patients towards the end of the year may sudden increase in copay due to reaching their drug payout limit. This is called the donut hole. Make sure you rightly calculate the day's supply on medications being dispensed. Metered dose inhalers typically have 200 sprays per device. Insurance will audit to see if the pharmacy calculated the day's supply correctly. Same with insulins, creams, ointments, and taper, and special dose packs. Day 20 focuses on calculations, including ratios, proportions, and concentration. Practice common pharmacy math formulas. Days 21 to 23 are dedicated to advanced calculations, such as compounding, flow rates, and business math. Use the provided worksheets. Day 24 focuses on order entry and processing. Understand different prescription formats and required information for dispensing. Day 25 covers billing and reimbursement, including third-party payers, copays, and common insurance terms. Days 26 to 27 focus on reviewing all competency areas covered in weeks 1 and 2, consolidating knowledge on medications and law. Week 3, review the advanced concepts and practice. Day 15, safety and calculations. Day 16, sterile basics. Day 17, the new supply chain security, DSCSA. Day 18, sterile compounding, may not be in the exam. Reviewing will help if you work or want to go to work at a hospital pharmacy or compounding pharmacy, where you will need to have some understanding of sterile compounding. Day 19, review and recap this week's topics, and take a minute. Week 3, focus on calculations, high alert medications, and start the mock exams if you are confident you are ready. Day 29 involves detailed review of the practice exam results. Focus on understanding the rationale behind incorrect answers. Day 29 involves detailed review of the practice exam results. Focus on understanding the rationale behind incorrect answers. Day 30 includes a final comprehensive review of high-yield topics and a second practice exam. Build confidence for the actual PTCB exam. The final video session reviews test-taking strategies and provides last-minute tips for success on the PTCB 2026 exam. Print the slides so you can review the details and plan the exam. Remember 1 minute 15 seconds for each exam question. Read, listen, review, practice, practice, practice. You will ace the exam. Good luck.